This is a double act from Regina, who's the manager at Beverley Lodge, and myself, David Thompson's GP. I must apologise on my own behalf for lack of preparation, because I only got back from a holiday conference, medical GP refresher course in South America. But coming out of that course, we had a very eminent and opinionated urologist lecturing, who said nobody should have a long-term indwelling urethral catheter. They should all be suprapubic. And the other thing, he said that the only ones, and I would agree with this, that you should be using are the barbed biocats, because some of the other ones, the coated ones, they have a little ridge and they're difficult to get out. Those are just some things. Anyway, Beverley Lodge is a small nursing home, isn't it?
Yeah, 16 beds.
Yeah. And it's convenient because it's just over the road from surgery, so we have not much in the way of communication.
I mean, we're really fortunate to have our GP right across the road, like Dr. Thomas was saying. I haven't got a specific resident to talk about, however...
I have.
Okay.
We took go on.
Okay. One in particular that Dr. Thomas and I just roughly discussed yesterday was a lady who came from another nursing home, and she has got dementia. She had quite a bit of challenging behaviour. Now, it's quite difficult with the other referrals. We get a quick response. With the challenging behaviour, referrals can be quite tricky. They could take their time. However, they managed to come in. Working with them had improved this lady's behaviour. Having Dr. Thomas on board, constant reviewing with medication, getting the other multidisciplinary ins helped as well. This lady suffered for quite some time. But what Dr. Thomas and I used to look at the medication, one of the things that we looked at was pain management, which really helped. A lot of the time she expressed her pain by shouting and waving. And then, you know, having the other medications in place, reviewing with Dr. Thomas, changing behaviour, taking their recommendations and opinions, really settled the resident down. And now she's come to a point where she's really settled. We haven't got much issues with her, except, you know, we have the occasional ups and downs with her behaviour. However, that's all been managed. It's been a success.
Yeah. I should add, she has two very caring, very loving, very anxious daughters who are in quite a lot, and they want to be involved in her care. And although we did have the challenging behaviour team in and they made a few suggestions, the outcome really was the discussion between the staff, who are there all the time, whereas I'm only in there occasionally. Challenging behaviour go in and they go out. And it's learning from the staff when she is bad, what she reacts to, speaking to the relatives, calming them down, and agreeing that, you know, you want to keep medication to a minimum. And we seem to have, with the discussions that we had, we seem to have got it right.
We have, yeah. It's been a great success. No, I just want to say as well, with the catheter issue, there's a lot of us who do lack in the skills. However, we did have the training a few months back. Having Ian on board is amazing, because I've had issues in the past where, you know, we've had with the catheters, and calling him out and him assisting us has helped a lot as well. So yes, Vanguard has lifted us and confidence as well. So yes, thank you, Vanguard.
Thank you.